we're not coming in to take over, but to do what you all determine are in the best interest of the San Luis Valley in your individual communities to be able to support those efforts. So basically, that's it in a nutshell. I may ask Dave Osborne from our shop if he has anything to add, and then I'm here to help with any questions and answers.
All right, thank you for that, Kevin. I don't know if you're that far ahead of us time-wise, but that's a beautiful sunset behind you.
Thanks. Let's just say it's a sunrise, a delayed one.
Sunrise, there you go. All right, Dave, would you like to add or talk a little bit about, carry on what he said a little bit more?
Sure. Thank you, Commissioner Jarvis. Thank you, Director Klein. Yeah, the state has developed a task force to address issues associated with the migrant, seasonal, and farm working personnel. And we're reaching out to see if there's anything we can do together to help. A lot of folks on that task force are on this call with us today, including Greg Sestinos from CDPHE, Christina Martinez, Kit Trainer from the Governor's Office, Charlotte Olson from Human Services. These are all members that are on board and ready to provide assistance if there is any assistance that's needed. So this meeting was requested to visit concerns with San Luis Valley decision makers and leadership related to the COVID response and service support to that migrant, seasonal, and farm working community. I guess there's a few points. One I might make would start off with the incident response. If there's any assistance, gaps, or anything that we could help complement the current Public Health Department Operations Center response, we're here to do that. I think CDPHE has provided a host of assistance with different teams and epidemiologists and other overhead to assist. So that's one piece. And then the second piece, again, is the migrant service or migrant seasonal farm working folks. So a lot of good work is happening on the ground. There is a San Luis Valley Agricultural Coalition that's been around for about 20 years. It's been activated to identify emergency needs in all of our communities, including homelessness, food inequities, and financial assistance. And they're working closely with the Colorado Department of Labor and Employment with Betty Velasquez as well, and I think she's on the call. There's also a group in Center, the Center Promotora Community Health Group, and they're coordinating and working in their communities, sharing information, sharing resources. And lastly, as Director Klein mentioned, a policy group. If there's a need for a regional policy group, as we lean forward with this incident or those in the future, that's a thing to throw out there to see if that's something that would help in the future. I don't know what the commissioner's thoughts are on that, but that's kind of a wrap there unless there's questions or comments.
Thanks, Dave.
Well, real quick, Dave, correct me. I thought we put a policy group together last month. Was that to activate our emergency managers if we need to, or whatever we need to do? Is that policy group not in place? I'm mistaken. I'm sorry if I am.
I don't know, Commissioner Jarvis, if that came to fruition. One of the thoughts for a regional policy group included representation, perhaps from each one of the counties, a commissioners group that could quickly come together to provide guidance and direction and parameters and delegations for an emergency that's unraveling. So I don't know that we've finalized that yet, and we might ask for some help to do that.
So does anybody out there? No, I thought we did. I thought we did this, and we all signed on to it, that we could get together and make budget decisions and things like that at our last meeting. Or maybe 2 meetings ago? But correct me if I'm wrong. And if we need to, let's do it. But
I might defer
Tim
to
Lovato on.
Tim Lovato if he's on the phone.
Yes, I'm on. I believe we all agreed to have a policy group, but I think we needed to work out the details, MOAs or whatever was needed to get this going, and who's going to represent each county. And we haven't gone to that next step. I think we're waiting for some black and white to know how it's going to function, who's going to do what, and represent each county. But that's the last I knew about. So I think not a problem or a question here is I think there's a lot of we don't really know what it's all about, and we've not really been filled into the exact details county by county. And I think if we had that, I think it would move forward a little quicker than what it is now.
Commissioner, can we help with that? Just put together maybe a straw man, you know, what the policy group looks like, what we do in other communities, for you all to review, modify, and sign off on?
I think that would be a big help.
Yeah, I think that would help a lot as well if there's something like that. I still, in my mind, I know I saw something, which is all right. We must have dropped the ball somewhere. But I'm pretty sure Rodney King presented one to us that was that type of document. But that's okay. Let's move forward and get it all in place. My other concern would be, as Dave was going through his list, there's a lot of groups already in place. Rather than create another one, I would say let's try to work with what's already there and maybe have representation rather than create another group. And I don't know that you're asking to create another group other than just one that will allow you guys to get going and make decisions that need to be done.
Yeah, we'll be happy to take, you know, what Rodney's put together and what the rest of the team. Absolutely, we don't want to recreate anything, and we want to just leverage what you already have in place. And we'll get that together. I know that Dave and his team are ready to roll on that. So we'll have that put together. The next thing is there anything between today and when we present that at the next meeting that we can help you all with as far as the response? Obviously, we are concerned statewide, you know, particularly with migrant workers and how do we protect them and their families. I think events may have changed what's going on both in the valley and statewide, just given what we're seeing with the virus transmission and seeing the work that has gone on that you guys have already done to suppress virus transmission. So, you know, that may have changed that portion of it, but we still want to make sure that what we're doing as a state addresses those special populations, but also the unique needs that you all face. So if there's anything that we can do in that interim, please don't hesitate. And I'm here if you've got anything that you want to bring up now.
All right. Does anybody have any concerns they'd like to address with Kevin?
Well, I would. This is Darius Allen, and good to see you there, Christina, with representing the state. And just a few things I'd like to bring up is we keep talking about migrant seasonal farm workers, and I had a good talk with Jill Ryan, and at the time they were using migrant workers title all the time, and I informed her that wasn't the correct title to be using. What we have in the valley at this time is a lot more agriculture employees who are citizens who live in our community, and they're not migrant. And they kept wanting to use the term migrant, and I told them it was the wrong term. I said, we get a lot of migrant workers come in during harvest time, a lot more. But and I guess I want to ask, what kind of assistance are you reaching to us to offer us? And is it in dollars? Is it in employees? What assistance are you looking at?
Sir, I thank you, and your point is well taken on agricultural employees, and in that I'll definitely take back and you know, work on my own use of language there. I think the help is both our employees and to help you leverage grant funding that's available to you, not only what we can do with FEMA public assistance in our division, but what DOLA has done with CARES Act funding to push out, but then, you know, any other sources, how we can best utilize those funds. ELC money from Colorado Department of Public Health and Environment, that's going to local public health agencies. So I think, you know, it's really, how do you make the best use of those dollars that are available? And if there's anything we can do to help with that. Certainly, I think there are economies of scale. We see this in other places where getting together and providing services as multiple, you know, multiple local governments getting together to do it provides some great economies where you can do more with the dollars that you have. But that's really your decision, and we are there to help facilitate that if we can.
And is there a projection of an outbreak? Is that what we're looking at? Are we jumping at shadows, or I guess are we trying to just stay ahead of the curve here?
Sir, I think it's both. Again, so statewide, what we're seeing is some good progress in the San Luis Valley. Statewide, we are concerned about increasing transmission rates and increasing hospitalizations. The model that was released yesterday, if we don't, work really hard to suppress virus transmission, it shows us in September exceeding our current healthcare capacity. So, it's human nature to socialize and be social. We are social animals. And as we, loosened up on restrictions, not everybody's, following the guidelines. I think that's just part of human nature. But, we really have to emphasize that we are looking at increased rate of transmission and exponential growth. So everything we can do to flatten that curve a little bit while maintaining the economy is really what our marching orders are, and what we're all doing. I think that the governor was very conflicted on the mask order that he issued yesterday. But the science shows that it's very effective. So we want to make sure that we're using those levers that are most effective. And we are concerned on a statewide basis that we're seeing increased transmission. I don't know, CDPHE folks might want to chime in and do that. I'm just going off of yesterday's model.
Good morning, everyone. This is Greg Stasinos. I'm with the Office of Emergency Preparedness and Response at the Colorado Department of Public Health and Environment. And I'd like to echo Director Klein's words of trying to support the region with any sort of resources that can be provided, and try to support the region with any future grant funding, such as the Protect Our Neighbor grant, which will help to solidify public health resources, such as new additional planners and data collection specialists, which will allow the region to absorb any future types of outbreaks and allow the region to utilize their resources more effectively and efficiently. So, as Director Klein mentioned, here to support and here to make sure that we're providing the right guidance from a public health standpoint.
All right, thank you, Greg, and thank you, Kevin. So I guess maybe what we ought to do, if it's okay, Dave, we'll kind of, maybe you and Commissioner Lobato, if that would be okay, if you guys can work a little bit on, and with Kevin, on getting that group or policy group in order and in place, and then email that out to everybody. Does that sound okay with everybody? Does that sound like something we need to do and move forward on?
I'm happy to.
Yes, sir.
Tim, are you okay with that? Commissioner?
I'm fine with that. I was waiting to hear from the other counties.
Well, I'm sure Conejos County is on board. We need to have it in place and work as a region. We always have, and I think that's our best way to do things always, because of the limited resources that we have. When we pull those resources, it works a little better. So yeah, if you can get that document together and emailed out to each county, and then we can look it over and comment and make changes or whatever we need to do or agree to.
Sure.
Does that sound
All
okay?
right. I'm good with that.
All right, we will do that, and I appreciate your time this morning.
Thank you, Kevin. Is there anything else for Kevin or Dave or Greg, anybody that's on the phone or on the video with?
Commissioner Jarvis, this is David Osborne. I just wanted to reiterate, you are exactly correct. Rodney King did develop a document, and I think we had 4 months ago, probably 3 or 4 of the counties that did sign it, but we still had a couple that were lacking. But the document you referenced is produced.
So I guess maybe send that back out and let's look at it, and maybe you guys, maybe your work is done. We just need to all get on board.
You bet. Thank you, sir.
All right, thank you. If there's nothing else for Kevin or David, we'll move on. So yesterday in our regular Board of County Commissioner meeting, our public health director presented the Protect Our Neighbors outline guideline, I guess. Helen Sigmund had emailed me a while back or texted me, and I apologize, Helen, I didn't get back to you. I've lost my phone, so I've been kind of in a mess. But anyway, I think we need to have this discussion moving forward. If any of you listened in on the state presentation back when they talked about Protect Our Neighbors, my feelings were, as I listened to it, the only way that we would ever be approved for that next step would be as a region. I don't think any one of us as a county could do it individually. Maybe Alamosa, maybe Rio Grande, because you have the hospitals in your area. But it does sound like it would be something we need to do as a region. I don't know, Helen, you've been involved with those meetings. I don't know if you want to talk a little bit. I don't know if Della is on the line. I don't know who wants to do this. Helen, would you like to give us a little bit of what you've been thinking?
Well, I did attend the Public Health Partnership meeting on Monday, and they're talking about, and Alamosa has actually applied for some monies to help with a regional approach towards dealing with the work that's going to have to be done to meet the requirements of Protect Our Neighbors. We're going to have to be able to show what the response will be from the community should rates go up. There's a lot that the state wants to see. I know with the variants, each of us had a different view, but it seems to me that as a region, we can go forward. We have been fortunate in July to have our positivity rate be going down, although it is up today, I understand. I think we have a chat note here that Kevin indicated our positivity rate is 6.3, up from 4.3 at the beginning of the week. We had 2 cases in Alamosa yesterday and 1 other case. So we had been fortunate to really have a low reporting of cases in July. It may be upticking again, but again, we still need all of this support to develop the documentation that's necessary for the state to have to proceed forward. So I just think our public health partnership, and I want to compliment them, does so well as a group working together. Right now we have 2 openings, I think, in departments in different counties, directorship, and the other counties have really stepped up to help those counties. So I would like to suggest that we go forward, or move that we go forward as a region to enter the next phase of protect our neighbors. I guess I don't have any response.
There, my computer was froze up. Sorry, guys. So was that an official motion, Helen?
Yeah, that's
what
my, I am moving that. I think we have to do this as region. I think the state's designed this program to be a regional approach, and I think we really have to go forward as a region. We are a region. You know, you can't say the virus stops at the county line in any one county. And sometimes one county might be having a higher rate than others, and then it shifts around. So I think we are a region and we should accept that and go forward as a region.
So I would ask if there's a second, and then we can open it up for discussion if anybody would like to second that motion.
This is Commissioner Garcia from Canals County, and I would like to second that motion.
All right, so we have a motion and a second. Now, is there any discussion?
This is Jason Anderson, Saguache County. Helen, it sounds like you have a bit more information. Can you flesh out for us really quickly just exactly what that would look like?
In terms of what? I mean, I think we have to present, you've seen the requirements on the website for what's required for Protect Our Neighbors and what the public health departments have to compile. It's a statement, support from the county commissioners. It's support from the hospitals, support from public health, and saying we're ready to make this next step. I don't have the outline in front of me, but it's all on the website. Maybe I should look that up.
Thank you, Helen, for refreshing my memory.
So is there any other discussion on this topic? Okay, hearing none, I would call for the vote. All in favor of moving forward to Protect Our Neighbors, say aye. Aye. Shake your head, yes. Any opposed? All right, it sounds like the motion carries. So Helen, it sounds like the group is already formed and working on that. Do they need more representation though, or what do you need from, I guess, each county? I know our public health director has been very involved, but there are some counties, as you mentioned, that don't have a director in place right now. What do you need from each county to help move this forward?
I think it will be a matter of getting this data together to support the, I don't know whether it's considered a request or what it is with the state. We should do that. Obviously, the initiative is going to be with the public health directors through the public health partnerships, but I think our support and then our responsiveness to individual public health directors' requests for specific help is what's needed.
So I guess at this time, I don't see any of our public health people on, but there's some phone numbers that I don't recognize either. I don't know, Denise Hiron, if you're on, if you want to comment a little bit, or Della, if either one of you are there, would you, do you guys need anything, or are you doing okay?
Commissioner Jarvis and Commissioner Sigmund, this is Michael Yon. I do have concerns that you go to the next step of Protect Our Neighbors, and then the governor has an order that supersedes or eliminates that. What is the point of doing that when you are being dictated to go to a lower level?
Helen, do you want to address that or?
Well, I think the virus is difficult to project or predict and how it approaches, but I am on the website, and the first step for Protect Our Neighbors is applying for a planning grant of up to $50,000 that is used to engage consultants, community partners, and finance community engagement efforts to listen, plan sessions with community impacted by increased risk of COVID. So I know Alamosa Della, our public health director Della, has applied for this $50,000 planning grant, and she is anticipating it to be helping our whole region. So we need to help our community infrastructure get ready for a potential increase once reopening is, or once we do continue on this reopening phase. I see the mask requirement as being one that will help us. I think if everyone wears a mask, then we will be able to have a lower transmission rate. So I don't see them being as diametrically opposed, Mike.
And I guess maybe, Mike, if I understand it correctly, to answer your question, if we get approved for the Protect Our Neighbors step, within our own, that allows us as a region to make decisions. And if those cases increase, then we have to have the parameters set in place that if it's a certain percentage or whatever it might be, and I think actually those are spelled out, that we drop back to the step on our own. We would have the ability to do that, even though we're under the Protect Our Neighbor. It would allow us to be more lenient or more strict, but it would be our decision, if I understand correctly.
And on at our last meeting, our public health director provided us with the color-coded approach. And did yours do that, Mitch?
Yes, she sure did.
Different levels: green,
yellow, orange, and red. Yes.
Yeah, green,
and
yellow,
blue,
orange, and red. Yeah. So I think, and a lot of this is going to be education that will be needed valley-wide. So I really see us as a region trying to address this, and number one importance to emphasize is the wearing of masks, in my view.
So if you go through all this effort and you get to Protect Our Neighbors step, which is the next step, and we definitely want to go there, and then the governor issues an order as safer at home. So automatically everything that you have done does not count for anything. You have to go by the governor's order.
But you'll never get out of that if you don't apply for this and work towards it. I mean, we all need to be working towards this so that our state does improve. You know, we were one of the hot spots, and now our positivity rate has gone way down. So I think it's important to continue on our success and continue forward.
And I understand what you're saying, Mr. Yan, because we've dealt with a few things like this. They've told the counties, you decide what your graduations will be like, and we worked with our schools, and then they came back and said, no, they can't be that way. But I think, if my understanding is correct, as Helen said, the only way to move forward and get out of the stay-at-home order, wherever we're at right now, is to apply for this and to move forward. That's the only way we're going to move forward, unless we just sit and wait for the state to go to it on its own. But I think from the conference call that we had a month ago or whenever it was, that this is the next step for everybody to take if you want to move forward more quickly.
And I agree with that. It was just kind of a heartburn that, you know, we want to go forward and proceed and do all we can. But like I said, it's just a little heartburn when you take steps forward and then you're taken two back. It's just where we're at.
And I think
Commissioner Jarvis,
experience that. Yes.
Commissioner Lovato, I have a question. If we are in the region, former region, would the counties still have the capability of doing their own individual variants within the region? Because we are different than Swatch County. It has a lot more areas than what Alamosa County has, and we may not have the issues that Alamosa County has, and yet we could open up a little quicker in some areas than, let's say, Alamosa County. So was that being in a region, would that be a possibility?
I think in our discussion yesterday with our public health, we brought that up. And one of the things that would have to be addressed in our application for Protect Our Neighbors is that even though we're applying as a region, that if it would be possible for each county to say Canes County was at green, and then all of a sudden we had an outbreak and we needed to drop back to orange or red. Would we be able to do that individually as a county, or does the whole region have to do that as a region? And so I think those are items that need to be addressed as a working group. And I know the public health people have already had those discussions and are having those discussions. But yeah, you're right, because it, like we've seen, it happens in Alamosa, then Canes, then Rio Grande. It moves around. It's not consistent throughout the region. But I think the only way we'll get our Protect Our Neighbors variance or step is if we apply as a region. We have to, I think.
And applying to the region gives us opportunities to apply for grants for infrastructure too that may be needed. So I think that's important as well.
Okay, so this would tie in with the policy group, and then we'd be able to have who's the CFO and who's the county that's going to be handling the finances for that, and how much each county is going to be have to come up with funding wise for this. And will there be an MOA?
I think that would have to be worked out, but it sounds to me like through the public health that they're doing the monies regionally through the public health. Correct, Helen?
Well, because we need to step forward, I think it is going through the what is it called, EFR or ER, the emergency regional funding. Is that what is it called? EPR, emergency protective. I'm having trouble with my
emergency preparedness and response.
Right. The emergency preparedness response. Right now, that to me seems, this is truly an emergency that we need to prepare and respond to. So it is going through that at this point in time.
So real quick, Jordan K just sent out a chat. I don't know if you saw that and said they could speak to this a little bit. So Jordan, if you want, go ahead and tell us what your thoughts are.
Thank you, Commissioner. So my name is Jordan Kemp. I am the Deputy Director for Alamosa County Public Health. I can speak to some of this questions a little bit further. So as far as the variance goes with what we've been discussing in this color-coded framework, under Protect Our Neighbor, there really is no variance. That's one of the things that the governor has indicated. It basically opens up at 50% of the capacity up to 500 people, regardless of your industry or what you are doing, once you've obtained the certification. So there's really no variance as far as out from underneath the order as a whole. That being said, the way that this framework is designed is it does go through those colors ranging from blue to red. And each individual county within the regional framework can be its own color. That's one of the things that we've discussed within the partnership. So let's say Alamosa County is in the blue area of Protect Our Neighbor, and then suddenly we experience some metrics that require us to pull it back down to, let's say, yellow. That is something that we could do without pulling down Rio Grande or Saguache or one of those other counties. As far as the funding goes, we have applied for a $50,000 Protect Our Neighbor grant to help support some regional positions. Those positions include like a regional coordinator, a part-time translator to help with our PIO duties, and a data management person to help us out with getting the data that we need to certify for Protect Our Neighbor and to keep the metrics in place. That $50,000 won't cover the estimate that we have for the total of what we're needing. We will end up having to come back to ask, each LPHA will have to ask for a certain amount of money over the top of it, but it should be a fairly low amount of money to help cover these positions, saying that we get this grant and can move forward with it. I can give a little bit more of a detailed update, but does anybody have any questions for me?
Thank you, Jordan, for that explanation. Any questions for Jordan?
So basically what you're saying is that if you have one county that is hot, it won't pull down the rest of the counties within this regional approach.
Most likely not. It does depend, because we are such a region when it comes to our healthcare system. There is always the chance that, let's say, we are capacity and we go for a certain amount of time that is out with, that could pull down another county. If we say, you know, Alamosa's hospital capacity has been exceeded for 2 weeks, every county might have to drop down a level because we all meet that same metric. But if we just say that one county has a high positivity rate, and needs to drop down a level, that would not affect a different county so long as the other metrics remain unchanged.
All right, thank you, Jordan. Any other questions or comments for Jordan or anyone else?
I might add, the last time Alamosa County we applied for a variance, it was put on hold because they kept telling us we want to see what the rest of the region was doing. So I don't think it's going to do any good to apply individually as a county, because the state is still going to look at our whole valley as a region. That's what they kept telling us. They put us on hold because they want to see what the rest of the region is doing.
Thank you for that, Darius, and I agree with that. Linda, did you say you want to comment a little bit? Linda Smith.
Yes, thank you. My understanding is there are a couple of different ways that we can do this. One is the full-on 100% regional approach where all the counties do this together. You go in together, you go out together. And there are some benefits to that that I think have been discussed already, both in terms of economy of scale and perspective of the regional situation, since we do share a hospital system and other things. Another way to approach it is to say we're going to use a regional approach to measuring where we are, and this color-coded approach is primarily about how do we measure it, how do we communicate it with one another and with the public. Maybe not every bit of the information on that color-coded piece is useful to the public, but at least within the decision-making group, then we're all looking at the same thing, we're speaking the same language. And if we do that as a region, we can either apply as a region, or we can have counties have the option to apply for Protect Your Neighbor on a county by county basis, which is significantly more work. I mean, it means each county needs to have their own separate.
But Linda, we already made a motion to apply regionally, so that's where we're headed.
Okay. So that was just to clarify. So yeah, so if we're doing it that way, then my understanding is the region goes as a whole, and we can follow our measurements as county by county to help us, move in the right direction. But it is region by region if we apply that way. That's my understanding.
All right, thank you for that.
So that's different than what Jordan said. Jordan, do you want to respond to that?
Yeah. We may have a different understanding. The way I understood what we had been talking about at the LPHA level was that within that regional approach to Protect Our Neighbor, we could still have individual color codings. It was almost the idea that we were discussing was like the fire bands. Today we are at a level blue or at a level green. And so within each individual county, we would have our own color essentially if we were differing enough to need our own colors. That being said, I may have misunderstood, and Linda could be correct because she's also been in on the same discussion. So I may have misunderstood and miscommunicated what we were needing to say, but I do believe that from my understanding within each area, you could have your own color. That may need more clarification though among the LPHAs.
Well, and I think that's the key right there. I don't know that anybody is misunderstanding or mishearing. I think those are decisions that have to be made as a group and put into that document when we send it to the state saying we're moving forward and this is what we would like to see. And I think that that's what people are working towards, if I'm not mistaken.
This is Commissioner Anderson. And, you know, my only concern is the one we always wrestle with, which is geography. We can rise and fall together, but because we're so vast, we have some very different situations. A case in point is when Saguache County put in for our variance, Heart of the Rockies was the hospital that stood with us as far as capacity. If the valley, you know, the rest of you guys may be with a different hospital, we wouldn't want to see a situation where our color changed because a medical system that we don't partner with as much goes down. So all I'm saying is there's got to be some flexibility as far as, you know, we all rise together, we all fall together, because we're too vast to do it that way.
And I agree with that. And I think that's, as I said, I think the group that's working together and from when our public health director presented to us, she said those were things that they were looking at and trying to get into place. And hopefully that's what can come out of it. And I guess I would encourage everybody on the line and on this meeting, if you have concerns, to make sure those concerns are brought up through your public health to the LPHA, to the people that are working on this moving forward, so that those things are addressed before we come up with the final product.
I do think I would like the counties have some flexibility that if it's completely hardline, I think that makes it really tough.
Thank you. Any other comments on this or concerns or questions?
Yeah, this Commissioner Lovato, the question I have is, you know, most grants, there are deliverables. So what are the deliverables that are tied to this $50,000 grant that they've applied for? And who's going to see and make sure that they're met and to the state's satisfaction?
Jordan, would you like to answer that, or do you know?
I can speak to it to some extent. So unfortunately, Commissioner, I can't say exactly what the deliverables that were written were. I'm not the one that wrote the grant. But what I can say is that we've applied for it as an Alamosa County grant to be used for a regional approach. So I believe it would be Alamosa County that would be monitoring the deliverables and making sure that the money is spent in a fiscally responsible way.
Yeah, that's my understanding as well.
So they would be on the hook if it wasn't that, not us as a region.
I think it's coming under the EPR, and so that's one that there's already an agreement on the EPR, as I understand it. So
that's my understanding as well, Helen.
Okay, I also have another question. Is if whenever we go together as a region, who is it that's going to approve the application for the certification? Is that going to be the public health partnership? Who is it that is responsible for that?
Well, this meeting is giving us the authority to go forward as a region, so we haven't we haven't had that issue come up, but I think the public health partnership, well, actually, as I recall, the Protect Our Neighbors requires approval of all the commissioners and support from the hospitals and, different entities. So you will have a say in that. And but the state's the ultimate one to give us the certification. So I don't know if that answers your question.
And I agree, Helen, before it goes to the state at all, it will come to every board of county commissioners. They will have to have a letter in place saying that they do support it, that they agree with what's in there, as well as our public health departments. So there's a lot of stuff already in place that will have to be met. And I think that's what the motion was just to be able to move forward and keep.
I was going to say,
go ahead, Carlos.
This is Commissioner Garcia. I'm looking at the form we were given yesterday. The list of agencies are the hospitals, the HA directors, county commissioners, sheriff, local police departments, mayors, emergency managers, and local tribes. So we're all going to have input in that.
So by the time we get approval from all of those people, is that going to take a tremendous amount of time?
Oh yeah, we were already talking mid-August, late August. It's going to be a while. So yeah, but we need to move forward.
Yeah, we need to get this. We need to get this people on board with this planning grant to get all these boxes checked off. Exactly. So.
All right. Any other questions or comments on this? I mean, we made the motion to move forward. I think if the public health directors, they've been doing a great job. I want to commend all of them. I don't know who is all on the line, but man, they've done an incredible job and they've put in countless hours and tireless hours and they're doing a great job. I think as commissioners and elected officials, whatever we can do to support them, we need to. But I think it's going to be a work in progress. We're going to have to move forward step by step, and I'm sure there'll be questions and concerns along the way. But any other comments or questions before we end?
Are you going to end the meeting or end this discussion on this portion?
Just this discussion so far.
Okay. All right.
Unless you're making a motion otherwise.
No, I'll wait till the end. I have a couple of comments to make at the end of the meeting.
All right, so if there's nothing else to discuss on the Protect Our Neighbors, I would ask if there is any other business.
Thank you. The governor come out yesterday with a new order that, again, a blanket order that, in my opinion, one size fits all. And I've never ever appreciated that because I've never have worked for rural Colorado, and talking to lots of my other commissioners around the state, they kind of feel the same way. I received some information yesterday, and the question was, does the governor really have the authority to do this? I'm going to forward on today to your different counties the excerpt of that so you can read it, and if you can, comment back what you think. And I guess the last thing I'd like to ask is it's just really tough when we're sitting down here with 50,000 people in the whole valley with 8,100 square miles, and our rates have dropped, but yet it just everything that he does anywhere else has to fit our wants down here, and it's not. I don't agree with that, but I guess what I want to ask is, he passed this, and I had lots and lots of calls yesterday from different organizations. What are we going to do, or how's your county going to enforce this when you start getting calls, seeing people walking around without a mask on or whatever? What's the other counties going to do? What's your sheriff's department going to do? What's your health department going to do? And I don't think we're going to be able to do anything, but let me know. Tell me what you guys are going to do.
This is Helen, and I'm going to set an example. I'm going to wear a mask. I have a statement that, you know, a lot of people are saying there's only a 1% mortality rate, which I think is not the correct amount. But for every one person who dies, 19 more require hospitalization. 18 of those will have permanent heart damage for the rest of their lives. 10 will have permanent lung damage. 3 will have strokes. 2 will have neurological damage that leads to chronic weakness and loss of coordination. 2 will have neurological damage that leads to loss of cognitive function. So we have all these outcomes, all these consequences, and we don't really know yet because this disease is so novel. But we need to do what we can. So let's tell everyone to wear a mask so we don't have confrontations. Let's not be resistive to wearing masks. Let's set an example.
And I don't know that the request was that we resist, but the question was, how are we going to enforce it? And that's always been my concern. Do we burden our sheriff's department with going in and enforcing a mask order, or our health department, who's already overworked anyway and can't keep up with what they have to do? Then are we going to start sending them out to every business and enforcing a mandate? And that's the hard part. And so yes, we need to set an example and be an example. My concern has always been, it's just like an unfunded mandate from the state. Here's our mandate. Now you guys deal with it and try to figure out how to make it work. And it's tough. I don't know how we would enforce it. To be honest with you, Darius, I have no idea.
There was an example given, this Rodney King example given on the news last night, that some of the sheriffs wouldn't actively enforce it. What would happen is they wouldn't give tickets for it. If somebody goes into an establishment and doesn't wear their mask and they tell them you can't come in, and they raise Cain about it, then they could be charged with trespassing. Is how they would enforce it. Is what they suggested.
Well, I mean, that would be, that's putting a lot of burden on a sheriff's department to have to go out to every call. But if they have to, or they will, I guess they can. Any other comments or questions concerning that, or thoughts on this? All right, hearing nothing. Is there any other business or any other items that anybody would like to discuss? All right, hearing none. If there's no other business, I would declare this meeting adjourned. Thank you all for your time. Appreciate it.
Thank you, Commissioner.
Thank you.